I'd like to introduce Sharon. She's a clinical nurse specialist from DEBRA New Zealand, and she has so kindly, agreed to kind of give us this talk, even though she's here for only 1 day.
Leave at 11 o'clock tonight.
So really, we really want to learn as much from you as possible. So do ask a lot of questions if you want to. There is also a visit to the A-Star lab after this if you are keen to go. Alright, I'm going to thank the A-Star people for helping out with Sharon's visit as well. Okay. So,
Great. Thank you, Mark.
Thank you.
Thank you. Look, I'm really excited to be here, but I'm also very conscious that all of you will have very limited time with lunch breaks and things like that, and my presentation is probably very long, so I will talk very quickly, and hopefully we'll have time for questions at the end. But I think from what I gather from Mark that you want to know a lot about, particularly the ones from the Skin Centre, the types of dressings and things that we would use for the EB patients. So that's why I'll quickly try and get to that part of it. But I know that with thinking about families and different people are different target audiences from different areas of work, that I've just tried to sort of put a bit of this and a bit of this and that in really to cover everybody. So hopefully it's not too much for you. And the other thing I was going to say, just to the families, like some of the photos are a little bit graphic, so so we'll just because for the health professionals, I think sometimes we need to have those in as well. So I hope you're okay with that. Okay. So just today's presentation is just to raise awareness really, and just to share some knowledge that I have there and answer any questions you may have. So EB, we know it's genetic from either recessive or dominant. It causes the skin and blistering not only to the skin but also the mucous membrane, so it can be from the esophagus right down to the anal area. So keeping the children regular with bowel motions and things like that, we're wanting to prevent constipation. That's a really big thing, so they're getting blistered in the anal area. It's not gender or race specific or contagious, and that really has to be emphasised when the children are going to preschool and schools. And that it can affect sort of 10 to 50 live births per million. It comes under the umbrella of genetically inherited defects, and depending on where the blister is or this skin problem is as to what type of EB it has. So what it means, just for families, we tend to just break it down, just telling them that the epidermis is the first layer of skin, dermis the inner layer of skin, lysis meaning breakdown, and blister the name of the blister. So basically a blister breaking down in either the epidermis or the dermal layer. For the health professionals, when they're looking at for a differential diagnosis, there's so many blistering skin conditions, so EB is only one of them, so they may have to work through the whole list before they actually come to EB. These are the classifications, and I think there's over 300 classifications now for EB. I was just showing Lucy before that there is a new article out on the classifications that was written this year, so that can be shared, and they are changing some of the names. But the common subtypes are still staying as EB simplex, junctional EB, dystrophic EB, or Kindler syndrome. And as I said, it depends on where in the skin cleavage the problem is with the skin, and to what types of protein genes are missing, or there's a defect there as to what type of EB they will have. So this is a typical blister of someone with EB. The difference between that sort of blister and that you and I would get and a blister to a person with EB is they're not self-limiting. So we have to lance them basically as soon as we see them, otherwise they grow before our very eyes. And the bigger they grow, by the time they do pop, I suppose is the best way to say, then they will be left with a bigger wound. So here's EB simplex, just showing that this affects, they're calling it now more localised EB, so it's mainly on the hands and the feet. And so it's just showing different pairs of feet with their blistering problems. And down in Mira, that also has another name. I think it's generalised intermediate EB is being called now, but again still comes under the EB subtype. Now you'll see their types of blisters are hepatic type blisters. So one of the mums that is from where I live in Christchurch, her child was born with EB down in Mira, And when the first time I remember her taking her out to the supermarket, she was approached by people, you know, basically telling her what a horrible mother she was, that what had she done to her child, she'd kissed her child and given it herpes, and you know, it's really, really traumatic for the families. So, and for this type of EB, it doesn't lend itself well to dressings at all. They actually will blister with dressings on a lot of the people with this type of EB. So there are a couple of other things we can do with that. And my background is in wound care. I'm actually a paediatric nurse at our local hospital in Christchurch. I still work 2 days a week at that hospital, and the wound resource nurse for that hospital. And my background's in burns and plastic surgery. So something I did for this little girl when she was younger, because she had the hepatic type blisters on her face, and I haven't put that photo up to show you today, but it was like, how are we going to, for wound care, when we're looking at healing wounds, we think about moist wound healing, keeping them moist to heal them quickly so they don't scar, because that general rule of scarring is that if something's not healed within 2 weeks, it's going to scar. So we didn't want scars on her face, so I just transferred knowledge from one area of my wound care field to another, and thought what I would do with a burns patient is I would put oil on that face and keep the nerve endings underneath nice and moist. So I would oil that, and that would lift, because it all went crusty, and that would lift the crust off. And of course, anything with crust, anything with eschar on, we're not sure, you know, what sort of bugs are underneath, and we wanted to lift that off and sort of get to a nice moist, a nice wound bed underneath. So yeah, putting the oil on. A week later I went back. My role in the hospital as well is to work with 7 children that come under the hospital with EB, and my job is to keep them infection free and out of hospital. So the parents, a lot of them have carers to help, as Eloise's mum has a carer to help her with dressings for her little girl, and so my role is to go and help those carers you know, with some ideas of what they can do. So a week later when I went back to see them, the face had healed. This is another type of EB called junctional EB. And so their life sometimes is short, and they can get widespread blistering, also in the GI and the GU tract as well. There's also EB with pylorocaltresia. And generalised EB is the term now that they use for dominant dystrophic EB, and so this is generalised all over the body. They tend to have a lot of milia, and their nails are affected, but their life expectancy is normal. This is someone with recessive dystrophic EB, and as you can see, lots of skin involvement there. They can have reduced life expectancy, but a lot of that is sometimes what, in this condition, if they're not managed well, they'll get sepsis. And so if we can manage the wounds properly, then that's the whole thing about preventing problems. So they can get widespread blistering, and again, as I said, it can be, you know, from the esophagus right through to the anal area. So it can be things that we won't always see. As I was saying to Eloise's mum before, you know, her child may actually have reflux too. She said that she's seen her have a little bit of cough up, a little bit of blood, so there may be some irritation there where there's been some blood internally, some blistering internally, and as the acid, you know, with a bit of reflux and acid, it's actually caused the blister to bleed. So sometimes we put our patients on an anti-reflux drug to help with that as well. This is actually just thinking, well, you know, a lot of the children actually present like this, but can we actually really diagnose what they have without, you know, doing a biopsy? So this wee one here has dominant dystrophic, improves and has normal life expectancy. This one here has junctional, and this one here recessive dystrophic, but they all sort of present quite similarly, really. So it is the ideal standard, gold standard is a biopsy to get definitive diagnosis. For neonates, we have to remember to be sensitive to normal handling for them, so to teach the health professionals to roll the babies onto rolled out arms, to take all their jewellery off, not to nurse them in an incubator if possible. It is heat, friction and pressure that cause the blistering for these people. And so, I mean, you have lots of heat here, and Singapore, I know, but an incubator is better as well for them. So use some soft silk sheets, again, so there's no friction. Pat the baby dry, no rubbing, otherwise that's friction as well. Taking name tags and the umbilical tags off your cords, and dressing the baby in clothes without seams are all things that can be helpful. In Malaysia, in New Zealand and Australia, we have a baby box set up in our neonatal units in case a baby is born. So Moonlicker Healthcare has donated them to both New Zealand, Australia, and I've just come back from Malaysia a month ago doing a road trip there and talking to some health professionals and families over there, and so they thought that was a good idea, so Moonlicker have also helped fund them a baby kit. So perhaps Moonlicker here may help Singapore as well. And it's just good, you know, like if you have a baby born unexpectedly, you know that you've got the dressings available straight away on hand without, you know, having to wait for them to come. And it's just a starting point really, but I can share what we have in our baby boxes with you so that you can have, you know, start that as well if you like. As I said, oral cavities can be affected. It's talking about, and so they can be a challenge then if the child's needing or adult's needing an anaesthetic. Esophageal problems, as I said, with reflux and things. So sometimes we actually don't know that they have a problem, and so if they have a barium swallow, that can tell us whether there is a problem there and whether they need. If the children are starting to drool, then they may need their esophagus, they may have a stricture there and they may need to have that fixed. And the rule of thumb with a patient with EB is to get the radiologist to read the film from the clavicle above, because the blisters are usually higher up. So these are lots of complications that can happen with people with EB. This is, we tend to put into a lot of prevention things. So this is mitten deformity here. This is actually a thumb of a child that has EB, recessive dystrophic EB, and so where their hands have clubbed and the web spaces have grown together. So we teach a technique called ABC wrapping, and that just helps to keep everything, you know, without that happening. So I can show that at the end. Also we have to, when doing dressings, we have to be mindful that we're wanting the limbs to not be restricted, so we don't cause any strictures and things. So how we cut our dressings. And Moonlicker again, for the nurses in the skin clinics, they will have lots of dressing guides and things to help you with the types of dressings that you have. And it may be that you're not using that particular dressing, but the guides will be very helpful for you to think about, you know, when you're doing those dressings on in those different places. So lots of potential health issues for these people that we have to be really mindful of. So my role, as I said, is to educate, support, and this is in the hospital, and to keep the patients infection free and out of hospital, and to be a resource person. I think with any wound care, we have to teach, not only we have to practice it in the hospital, we have to teach our families as well about good hand washing and universal precautions. MRSA is a big thing, you know, happening around the world, and so obviously if the wounds get infected then, and they're not going to heal, an EB wound is like any other wound, it still needs the same principles of wound healing still apply. In Christchurch, where I came from, we had earthquakes a few years ago, and so that was a problem then with our water supplies, what we were going to do. So there was a product there that I was able to introduce that was in a can that we were able to wash the, when you shook it up, it was called Peri Foam. I don't know whether you can get that here, but you shook it up, and it's tea tree oil based, and comes into a foam, and then we were able to clean the wounds without using any water at all. So that was really, really helpful. So everyone has that in their first aid kits now. Everyone also keeps Glad Wrap in their. Are you troubled with earthquakes here in Singapore? No, lucky. Oh, it's good I'm not coming to a city that's shaky then. Yeah, so we would keep Glad Wrap in their drawers, so that if they're in the middle of a dressing change, and the same with burns patients, you know, if we're wanting to seal nerve endings, we need to keep air off it. So if they're in the middle of a dressing change and they had to go outside, then the air was going to get to it. So they take the glad back with them. They could wrap that around their wounds, so they'd have instant pain relief. The nerve endings would be, seared all from the ear, and it would also help with infection problems as well at that time. I come from a place called Christchurch, which is known as the Garden City. This is actually the view outside the children's ward that I work in, so it's very nice. I often take the children along the river, and we have ice creams and feed the ducks out there. So as I said, prevention of infection is really, really important. So hand washing, reducing that risk of cross-infection, reducing the itching, because this is not what we want with the people with EB. We don't want them itching because they're just going to cause more skin problems. And we need to also teach them that they need to change any wet dressings, so because infection can get in from the outside in. And that's just showing universal precautions, but where we've actually missed a spot with hand washing. There are lots of physician documents out there that can help us with our practice. So one of them is on pain management. And so another thing we have to consider, obviously, when we're helping the little ones, is to think about how we can distract them, what sort of play, being really organised before we start any dressings and things, so that we can do it as quickly as possible. A lot of the older ones, when they get a lot older, they may be able to be taught guided imagery, so they can take their mind somewhere else and they're not in the room at the time of the dressing change. It's just putting some relaxation music into place, or if we need to give the medication. But obviously we try not to sedate or anything too much, because this is lifelong. They live with us, and we are looking at other ways that we can prevent problems. So this is showing one of my little people in Christchurch I look after, so I popped in to see him for the day. He's having some play therapy. You can see out the top he's having some bubbles blowing there. Someone's looking after him, making sure he's safe on the changing table. Someone with sterile gloves is lancing his blister. And so he's very happy. So it might be that even though he's having a blister lance, he may cry, but it might just be because he's bored and he needs some distraction. Or someone might be hungry, so they need a bottle. So, thinking about that it's not just all about the wound, it's not just all about EB. They have normal needs, like every other child. They're normal in every way, except they have a skin problem. Now, these books, sorry, that is really distorted. But these two books are very good, with lots of information in them, and I believe they've just come online, that you can actually download them now. So I can send that link to you, Mark. We've just had that sent to us in New Zealand, so I don't have it with me at the moment, but I can send you the link for that. And that might be something that you would like to do. Or I think Amazon, if you want to buy those books, they are available. So some main points of caring for a client with EB is just that there are different types of EB, and they present sometimes the same, but the severity can vary. We need prompt diagnosis. Sometimes that's crucial for some of them. And we need the diagnosis because, that helps us with research, and that along the way with different research, things that they're finding. If they can, if they're on a registry, then they can go to the registry and say, okay, there's this many people in Singapore with this type, and we're going to give them access to, this, trialing this. So, it's just about knowing that, also knowing the appropriate dressings for that wound management, and as I said, pain relief and that. Nutritional considerations are really, really important as well. So it's not just about the dressings that we put on the wound. It's obviously we can put the best dressings on the wound, but if they're not cleaned, then we're not going to get anywhere, because they've got to be cleaned first. But also what's happening inside for helping to heal those wounds quickly. So we use oral supplements a lot in New Zealand, and I don't know, do you have these available, oral supplements available in Singapore? So it's all about the multi-D team, so it's just not about us as nurses and doctors, it's also about the dietitians and the OTs and physios and all that being involved. And we know that there's lots of things that affect the wound healing, so as I said, the dressings are just one of them, and nutrition is also very, very important. For the older population, the ones that smoke, we need to teach them that smoking is going to delay their wound healing. And I think it's like 1 cigarette delays wound healing by an hour. So that's really important. The other thing that I'm really hot on is temperature fluctuations. I mean, you probably won't have trouble with that here in Singapore, but you certainly do in Christchurch, where I come from. So if we're going to be changing a dressing, we need to make sure that our room is warm. So I suppose here you would have to make sure that your air conditioning is not turned up too much, so it's quite too cold. And we also need to make sure the temperature cleaning solutions are about the right temperature as our body, so we're not cooling down the wound as we're cleaning them. The reason I say that is, you know, if your wounds heal by the right temperature, so I think that the optimum temperature is 36.1, 37.2, and so if we cool our body down to about 35, and then it takes an hour to get up to that temperature, and then we've done we've done a dressing change for every day, that's 7 hours of healing time that we've lost in that week. So we just have to be mindful of that. And there isn't any one ideal dressing, and not the same dressing that might be for this one person that has recessive dystrophic, it won't suit the next person that has recessive dystrophic. So it's about working with the people that have EB and their families and seeing what works for them. We don't tend to use antimicrobial dressings for any longer than 2 weeks. We rotate them, and one of the new specialists in the UK is writing a paper on that at the moment, and she's found that it's actually lowered raised the serum silver plasma levels with some of their patients, and of course we don't know how detrimental that's going to be for kidneys and liver, brains, all that sort of thing down the track. So we're just mindful that we just rotate things. And so the moon liquor products are, or the silicone products are really the products of choice, and with a lot of our patients with EB. There are other things out there as well, which I'll touch on at the moment, but these products are used all around the world. So there are things that I have on the table here. There's some new things in their range, and I won't get them out because I know you've got samples over there, but this one here is called Meepitel 1. So are you familiar with Meepitel? So this one is just sticky on one side, which is really, really good for like fingers and things. It's really good if you just want it to stick to the finger, but you don't want anything else to stick to the outside, so that's really cool. And Nepelix Light is good as well. Sometimes they're a little bit difficult with staying on though, so we tend to use like tubey fast garments like we would have with our eczema patients and that in New Zealand as well. And of course wearing these with the seams out, so that the seams aren't going to cause a problem. So this is the wee one just having his garments put on over top of his dressings. Let's talk about nutrition, and they're all the people, as I said, that would probably be involved with one child. Here's a little one, distraction. While he's being measured for his finger gloves, he's playing on my phone there, and then while he's going to the dentist, so I don't know what he's got the glasses on because his eyes do get affected with light, but he's been given something else to concentrate on as well, which is keeping him entertained, which is great. And for them to have relationships with the people that look after them in hospital. He's also come in for an iron transfusion here, so this is his favourite nurse in hospital, so I think it's important that she has a photo with him, and so they have a great time when he comes to hospital. It's about making it not too scary. I have bought some books which particularly for the children that can go to the hospital. Going to hospital was a book that I was involved with writing a few years ago, and we've just updated the photos, so he's actually in it now, but it just talks, just again it's about trying to allay the fears for the children and not get them to be scared about coming in to see us. Otherwise, they've got this for lifelong at the moment, and we need to make sure that they're happy about coming to see us. So what is DEBRA? It is a self-help group for people and families with EB. It's a charitable trust, and it's an organisation that's reliant on grants and donations, etc. And for us, our dressings are funded in New Zealand, and I believe they're not for you here in Singapore. So again, you'll be wanting to work in the most cost-effective ways as possible that you can. There's DEBRA International, so the umbrella that all the DEBRA groups come under. EB Clinet has been set up a few years ago, and this is a clinical networking group with lots of experts around the world. And I was lucky to go to that meeting last year, and it was a fabulous meeting. EB Without Borders, and that was about it's about us reaching out and helping people that don't have a DEBRA group. so I help some families in Sri Lanka and keep in touch with them via email. Send over some of our expired dressings that we're not allowed to use anymore in New Zealand. It doesn't seem right that they can use them, but we're not allowed to. But in actual fact, there's nothing wrong with them. They've just expired and they have to have a date on them. But still, it's better than what they don't already have. And also, we've just had a nurse fly to Tonga to help over there, one of our New Zealand nurses, because they don't have a DEBRA there as well. Australian New Zealand DEBRA Nursing Group was set up about 4 years ago, and this is our group here. And we're just, because we're so close, three hours away on a plane ride, we work quite closely together, writing protocols and troubleshooting together. DEBRA International is involved with lots of research, and their priorities are around biology and genetics of EB, looking at therapy development with genes and cell therapy, looking at skin cancers that can be a problem, and clinical care research, so on pain and quality of life and things like that. These are really good documents that, again, you might be interested in. If you haven't already seen them, I can share these with you. And they talks about some good dressings and some things on how to care with people with EB. So this is actually written by nurses in the UK, and then a lot of us around the world have actually reviewed that. And then this one, people weren't communicating, and EB with clinicians now sort of made a bit of a rule that everything needs to go through them now as things are being developed, so one hand knows what the other one's doing basically, but the doctors were writing this one and the nurses were writing this one, and we're talking to one another, so we have two come out at basically very similar time, but I can share those with you. There are also guidelines on dental guidelines for the patients, and anaesthetic guidelines for adults and children. So again, if you have patients going to have an operation in the hospital, we can share those with you as well. And so the aims of DEBRA New Zealand is to offer that specialist advice to healthcare professionals in the hospital and the community, empower the families, and just basically make the overall goal, for them to be able to achieve their maximum health potential. And that's the DEBRA New Zealand nursing team. We are dressed up there going to a ball. We were fundraising for DEBRA Australia, and so they had their first butterfly ball last year, the year before, 2 years ago, and so we went to that. So 3 nurses, Jane in the middle and Jackie on the other side. We all cover New Zealand, so I live here in Christchurch and cover all of the South Island and the lower half of the North Island, and then the other 2 where most of the population is, cover up the top. We talk about toys, being considerations into, what sort of things we let the children play with. We need things that are soft, not hard, not with rounded corners, not with pointed, so that they're not going to hurt themselves. We think about, car seats, it can be like a razor blade basically cutting into them when we're sending them out of hospital, particularly the OTs, they might be interested in this, they might need to pad their little seat belts so that it's not hurting the babies. Footwear can be a problem for them, so again it's about seams and things like that, finding what's right for them. In New Zealand, a lot of them tend to find that the wee Crocs are really great, they're nice and light, but also they don't have any seams and things, so they don't cause problems. And we use a lot of boat shoes for the children as well. I'm just going to quickly show you a couple of slides. I did a trial with a new dress. This is actually a dressing. I'll just hand it round. You can put a little bit on your hand. It's you don't think it's a dressing because it's actually a gel. But you just put a little piece on your hand. If you rub it round and then just let it dry, and you'll see just over 5 minutes it'll go tacky. Don't put too much on because it'll take a while to dry. But it goes tacky, and then it leaves a film on there, and then it dries, and so it's a dressing. So as I said, some of the conditions don't lend themselves well to dressings, or they may not, it's maybe too hot to have a big thick dressing on, so this is another alternative. I did the first trials with this in New Zealand because it actually is a gel that was developed in New Zealand. It's keratin protein, which has been extracted from sheep's wool. When I first heard about it, I thought, oh, keratin protein, oh hey, I work with people that have a keratin deficiency, maybe if I put it on their skin it might be helpful, could I try some? So they gave me samples, And so, as I said, I did those first trials, and now it is used with a lot of DEBRA patients around the world. So this is one of the wee girls with recessive dystrophic, and she'd been having blistering for 10 years. And she used to wear dressings all on her neck, and after 3 months, and like some people do give up after using things for a couple of weeks. And we do say, if you don't see some improvement with a couple of weeks, then start rotating your products. But when you've got a chronic condition that you've had for a long time, you probably have to give it a little bit longer. But this young lady, she was seeing some progress, so she kept on with it, and after 3 months she was totally healed there, and she doesn't wear dressings there now. And so that was back in 2007, 2008, I think, I did the trials with her on that. And so she continues to use that today, and so do others around the world. And this is a little boy with recessive dystrophic as well, and both the feet used to he used to lose his skin like this all the time. And so we had 1 foot in the trial and 1 foot out of the trial, and you can see a month into treatment the other foot had totally healed as well. Now that's not available in Singapore now, but I know that there has been at least one doctor that's made an inquiry to the company, and so they've asked me to bring some over and show you. So I have some samples, so Mark, if you have some patients that you want to trial this with, I have some samples, and then they will look for a distributor if it's something that is useful for you guys, if your patients think that it's useful. That was a poster that I then presented at the DEBRA, at the New Zealand, at the Australian Wound Care Conference, and there's been a couple of published papers on that since. We run camps in New Zealand for our children. This is actually an Australian family that came across for the camp, and it's all about normalising the children. So just as I said, they have a skin condition, but they're normal in every other way. So we just want them to have the experiences that anybody else would have. So we take them horse riding, we take them, the ones that can't walk and are in wheelchairs, we take them skiing, and this little one he goes swimming. Actually, I think one of the slides I've missed there, because it's probably jumped over and you probably saw it, of the wee boy in a bath. So something we do, if it's painful when they get into a bath, we add a lot of salt into our bath water, just make an isotonic solution, where the salt is then the same concentration on the outside as it is on the inside of their bodies. We make a 9.9% saline solution, and so then it's not stingy when they get into the bath. So they tend to bath in that, and then he also goes swimming, but we also, when he doesn't go swimming, we put him into bleach in the bath, and that also helps keep the infection at bay. So, and there are some guidelines on that. If you use DERMNet, New Zealand, there's one of our paediatricians has just written up some bleach guidelines, or I can send you the guidelines on the bleach. It's just some references, and so I'm just going to thank Margaret May Blackwell. The reason I'm here today is because I did win a nursing travel and study fellowship, and I've actually come to go to the laboratory to have a look and see how they are doing their when the biopsies come, what they do with them. And we're not getting definitive results with our biopsies in New Zealand, and which is really frustrating for everybody. And so I'm just looking at how we might be able to make some changes and then take that information back to New Zealand. Also, thank you to my nursing colleagues who are holding fort while I'm away, and to the families that have let me show their pictures and that today. So that's just all I have, but I do have a couple of things I haven't said. So in the EB baby box, I think it's really important for the little ones when they're born. Some of them we handle with care stickers. It might be good to sort of put those in. I don't know what this is from New Zealand, but you may be able to get some of these, or you may have something that's been written by your dietitians here as well. But that's just Nutrition and Wound Healing, which is quite a good book. It just tells people, it's quite easy to understand for the families too, why they have to give their children more extra protein for wound healing. These were the guidelines for dental. These were some wee gloves that I didn't show, but sometimes I'm going to show the ABC hand wrapping now. And then this is another way. They say that you only have to have the hands, if the children are starting to find that their hands are starting to, contract over, then this is one way that they can you can keep them stretched out. And the other way is with ABC wrapping, which I'll show. And for some of the little ones with EB simplex, don't want to look different. So they want to wear the normal clothes that everyone else wants to wear. So as long as their undergarments don't have the seams on them that are going to cause them more problems, then they can put just ordinary things on the outside, so the ordinary pair of leggings. But someone might like to sew a pocket on the inside, and then you just put a pad or something in there, so that when the wee one's crawling around the floor, they've got some padding already, and then they're not all, and they're not always having to use it. They can just take them out, wash them, and then put the pad back in. So it's another way to save money. So especially when you haven't got your dressings aren't funded here. Do you have the heel, Mepilex heel at all? Dressing? Do you have a Mepilex heel dressing? Oh, you haven't bought it today? Okay, so Moonlicker do have a product called a Mepilex heel dressing. It's sort of like cut like that. And that was really good to make a little baby's booty out of. And again, it's about, trying to, when the parents are faced with having a baby that they've, just delivered with EB, they're already distraught, and to then not be able to put them into, normal clothing that they would already have prepared for them, like they wear babies' booties and things like this. So we've got to try and, simplify things for them. If we can put a dressing on, make it look like a bootie so they can put their bootie over top, then, it's how can we sort of do that for them. So, and the other thing we use a lot of is barrier cream. So I don't know, you use a lot of barrier cream. So on the skin that isn't infected, it's important that we try and preserve that. So using a barrier cream, so so they don't get blisters. Yeah, so it just puts that extra layer there just to help with the friction and things like that. Yeah, so I've got a few guidelines here, which I can leave with you, Mark. Okay.